Hello, welcome to the sleep clinic. You must be my 10 p.m. sleep study appointment. Is that right? Great. Come on, take a seat, please. Did the nurses up front get you checked in all right? They take your vitals and everything? Great. So, before we get started, why don't you tell me how long you've had trouble sleeping for? About 6 months. And when you are trying to fall asleep at night, are you experiencing racing thoughts, feelings of anxiety, feelings of depression even? Okay. Alright. Are you feeling tired during the day? Do you find yourself napping during the day or even nodding off while you're working or in school or in class? You do. Okay. You've never just fallen asleep suddenly for no reason though, correct? No? Okay. Well, we can rule out narcolepsy then. Alright. So before we get started with the sleep study tonight, I just am going to be performing a quick cranial nerve exam. This is a pretty routine exam that we like to perform on our patients just to rule out any possible neurological issues that would be obvious during this exam. Is that okay with you? Great. It's very easy. It's very relaxing. You may even fall asleep during it, which is perfectly fine. Anything that we can do to help you sleep, it's what we're here for. So, prior to getting started, I'm just going to get a pair of gloves on, and we will get this exam underway. So bear with me one moment. So, when was the last time you actually got a full 8 hours of sleep? It's been that long. What's your normal bedtime? 2 a.m. And you normally wake up around when, if you do sleep that night? Around 5 a.m. So you aren't even really getting into a REM pattern with your sleep, which means you're not getting restorative and restful sleep at night. Well, we're going to get to the bottom of that tonight for you. We're going to do this sleep study where we will monitor your brain activity during the nighttime to see if we can see anything. And we will figure out a treatment plan for you from there. Alright? So for the first part of this cranial nerve exam, I'm just going to be examining your face and palpating around your sinuses and around your temples and around your forehead, just examining your scalp just for any lumps or bumps, and you let me know if anything feels uncomfortable at any time, okay? Alright, just gonna take a look up here. Your hair looks good, nice and healthy, so that's good. And if I press right here on your temples, how does that feel? No pressure? No pain? Okay. And if I press right here under your eyes and just gently press and run my fingers across your sinuses, how does that feel? Okay. Alright, very good. And just gonna feel up here on the forehead. Just gonna palpate gently, palpate gently, palpate gently. Very good, very good. Alright. Good. Not seeing anything that is abnormal. For the first part, though, of this exam, we are going to be testing your olfactory nerve, your sense of smell. I'm going to be placing a few different scents under your nose while you close your eyes, and I want you to tell me what they are, alright? Okay. For the first scent here, just going to open this up. Just go ahead and close your eyes for me. Close them, close them, close them. Very good. Now, take a smell of that. And what do you smell? Cherries, very good. Very, very good. Alright. For our second scent, go ahead, Take a smell. Coffee. Very good. Very good. Keep those eyes closed. Keep them closed. And for our last scent, let's see if you can guess this. Take a smell. Lavender. Very good. We utilize a lot of lavender scent in the clinic. It helps promote relaxation, a feeling of calm, and a feeling of peace, which is all great to help you sleep. But your olfactory nerve seems a-okay. I'm just going to mark that down on your chart. Sense of smell. Great. Next, we are going to move on to your optic nerve. For the first part, testing your optic nerve. I'm going to be using a light to shine it in your eyes to test your pupillary response. Then I'm going to be taking a deeper look in your eyes to make sure we're not seeing any inflammation of your optic nerve. And then we're going to be doing a little bit of an eye exam on you just to make sure that you aren't straining, because there have been studies that shown that people who have undiagnosed eye issues that strain to go about their daily lives also have trouble sleeping. And we want to rule that out as well. So the first part of this, I'm just going to be taking my light here, as you can see, not very bright, and I'm going to be covering one side of your eye. I'm going to be bringing this in and out of your vision just to see if your pupil dilates and how it reacts, okay? Great. So here we go. And we're in and out. And in and out. In and out. And in and out. Very good. And let's look at the other eye. In, out, and in and out. In, out, and in, out. Very, very good. Now I'm going to be taking a little bit of a closer look inside your eye. So I'm going to be looking into each eye individually, and I'm going to be just looking to make sure that your optic nerve isn't having any issues, okay? Alright, so open your eye real wide for me. Hold still. I'm just going to be looking inside, looking inside, looking inside. Okay, everything looks good. Everything looks good. Alright, let's take a look at the other side here. Okay. Everything looks good on this side as well. Your eyes seem in perfect shape. However, just to make sure that we're being extremely thorough, I'm going to be taking an even closer look inside your eyes. So, if you would do me a favor of just holding very still, hold very still. Okay. Let's take a look over into this eye, this eye. See if we can tighten up here. Alright. Well, I'd say that I'm not seeing any issues with your eyes physically. We have a couple more eye tests to run with you though. For the next part, I'm going to be testing your peripheral vision. So I'm going to take my fingers like this, and I'm going to keep moving them in and out of your line of view. And I want you to tell me when you can see them and when they go away. You ready? Okay, let's get started. So, good. 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 Let's go this direction. Good. job. Well, your peripheral vision seems to be in perfect shape. Perfect shape. Now, for the last part of the eye test, we're going to be doing a quick eye exam. We're going to be doing one close up, and then one on the Snellen chart on the wall back there, a little farther away, alright? Great. So if you could just go ahead and close your eye, your red eye, and read that top line for me. Good. And read this line. Good. This line. Good. Good. And how about down here? Fantastic. And one more down here. Great. Now, if you could just direct your eyes to the Snellen chart, we're going to be doing the same thing. I'm going to be asking you to cover your right eye and then your left eye and read which line I point to, okay? Alright. Now, look over here. Now, if you would please cover your right eye and read this letter. Good. 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 Now let's go down to this line with your right eye only, please. Good. 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 Very good. 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 Now, can you do this line with your right eye? Very good. Now, I want you to cover your left eye, and I want you to read the letter I point to, starting here. Good. Good. Very good. Good. And this line. Good. 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 Great. And how about this line all the way down here? Good. Good. Perfect. Good. Good. Very good. Your eyes are looking fantastic, my friend. So we're going to do one more quick test, just to make sure those eyes are perfectly okay. So we're going to go back with the light, but this time we're going to do a little follow the light, alright? So what I want you to do is I want you to look right here at my nose, okay? Don't move your head, just look right at my nose, and I want you to follow the light with your eyes, alright? Keep looking at me, and follow the light. Follow, 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 follow. Good job. Keep following. Keep following the light. And bring it in and out, and then in again and out. Keep following, keep following, keep following. Very, very good. Fantastic. I would say your eyes are perfectly healthy. No worries there. Now, if you were to have this exam at a regular physical, it might be a little more in depth, but we are just looking to make sure that there's nothing blatantly obvious that could be causing an issue. So your optic nerve looks good, your ocular motor function looks good. Your trochlear nerve looks fine. Now this next part is a little bit uncomfortable. It will not be painful in any way, but it may be a little bit uncomfortable. So what I'm going to be testing is your trigeminal nerve. So I'm going to be taking a little bit of cotton, and I'm going to be brushing it right here at your eye. I'm going to be touching just the very, very edge of the white of your eye, just to make sure we see the proper blink reaction, okay? I know, it won't be too scary though, I promise. So I'm just going to grab one of my cotton balls. We recently updated the office to give it a more comfortable feel for our patients, including some new accessories, like these nice little wood top jars. So what I'm going to do is I'm just going to pull out this cotton a little bit. I'm just going to twist, until we get that little tiny wisp. Just this little wisp, and I'm just going to touch right here on the outside of your white, okay? So, just hold perfectly still and a little brush. Okay, good. And on the other side, little brush. Okay, good. See, not too scary. Didn't hurt. It's just one of those things that we have to do sometimes. Trigeminal nerve looks good. Alright. Let's go ahead and take a look at your facial nerve. So I'm going to be asking you to make a couple of different facial expressions for me. So why don't you go ahead, give me a big smile. Great. Give me a big frown. Good. Give me a surprise face. Like, great. Go ahead now. Puff out your cheeks. Just like that. Great. Now, can you lift one eyebrow? Good try. Not everyone can do it, and that's okay. Alright, so I'm going to go ahead here, and I'm going to just feel around your neck a little bit. Just feeling your lymph nodes, making sure nothing's swollen. Good. Working my way down the sides of your throat a little bit. There we go. And then up back here behind the ears. Nothing feels too swollen there. Back under that jaw. Alright. Hold my hands on your jaw here. Go ahead and clench your jaw real tight for me. Like that. Very good. Clench again. Real tight. Very good. Now open real wide. And clench again. Good. Alright, now I'm going to just press gently on the side of your trachea. Go ahead and try and swallow for me. Good. And I'm going to press on the other side. Now go ahead and swallow for me. Good. Alright, thyroid has no issues. So that's good. Great. Facial nerve looks great. Vagus nerve sounds good. Alright. We're going to take a look at your accessory nerves now. So, what I'm going to do is I'm going to place my hands on your shoulders. And I want you to try to lift your shoulders while I press down. And I want you to push against my hands, alright? Alright, so, and push, 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 push. Very good. One more time. Push, 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 push. Very good. Now I'm going to place my hand on the side of your face, and I'm going to be trying to push your face, resist my hand, and push, push, push. Very good. And on the other side now. Push, push, push. Very good, very good. I would like to do one more test on your facial nerve, and that is a sensation test. So what I'm going to be doing is I'm going to ask you to close your eyes again, and I'm going to be touching you on different parts of your face and neck with either this cotton swab here or the blunt end of this tool. This is not sharp. This will not pierce your skin, and it's not even very cold. It's just a nice dull sensation, so I'd like you to tell me soft or sharp here. Alright, so go ahead, close your eyes for me. Close your eyes, close your eyes, close your eyes. Very good. And touch. Soft, very good. Touch. Sharp. Touch. Soft. Touch. Soft. Sharp, touch, sharp, touch, sharp again, Very good. Well, looks like you are perfectly capable of determining if something is actually interacting with your skin, so I'm not too worried about anything going on there. Let's move on, shall we? Well, my friend, I don't think that there's anything wrong neurologically with you. So why don't we get on to the sleep study part of your visit. So for this night that you will be staying with us, we are going to be monitoring your brain activity while you sleep. And we're also going to try to help you fall asleep. So what I'm going to be doing is placing these electropads on your skin so we can monitor your activity while you sleep. Okay, so we're just going to stick this one right there. Good. And this one will go over here. Make sure that sticks. Make sure that sticks. So much plastic waste these days. Maybe one day the medical suppliers will get into biodegradable plastics. Alright, just a few more. It's very, very sticky. Very sticky indeed. One more over here. Make sure that sticks on your skin. Oh, these will come out very easy. And then just a quick wash with some soap and water, and there will be no residue left. And last one goes right there on the forehead. Yes, it's a little cool, but your body heat will warm it up and you won't even notice it's there tonight. I promise. So now that we have those placed on your skin and you're all hooked up and we can see what's going on inside your head, how are you feeling at this moment? Are you feeling anxious? A little bit? I understand. It can always be a little bit daunting when you don't know why something is happening, but it can also be a little scary to find out the answer. But I assure you that if we find anything, we will come up with a treatment plan that's right for you and get you all better, alright? Alright, so why don't you lean back right now, and I'm going to actually light this lavender candle for you to let that nice, calming, soothing lavender scent fill the room. And I'll put on some nice music, and we'll see if we can get you to drift off to sleep, okay? Great. Alright, my friend. Well, now that we have the candle lit, the room smells nice, and we're going to try and get you relaxed and see if we can get you to drift off to sleep. And at the end of this, I'm going to leave the room and let you fall asleep, and we will monitor you all night. So, first things first, one thing that we have found during our numerous studies on patients is that people very much enjoy the nice sensation of a brush against their skin. They enjoy feeling the tiny, soft bristles just taking away their worries with every single little stroke. very relaxing. It's very relaxing. You can just close your eyes and not worry about anything right now. You are perfectly safe here in the clinic. You will be taken care of. You will be cared for. And we will find a solution to your sleeping problems. And it's okay to drift off to sleep. It's okay to drift off to sleep. It's okay. It's okay. Go to sleep. And when you wake up in the morning, you will feel nice and refreshed. And we will have a game plan for you to help you sleep more and sleep better more regularly. There we go. Go to sleep. Go to sleep. Good night. Good night. Good night.